watching the Fox 13 10 o'clock news in HD.
Joining me now to talk more about this is Dr. Nelson Mañé. He's a board-certified chiropractic neurologist who specializes in treating children with developmental disorders. So first of all, Dr. Mañé, what kind of alternative treatments are out there for ADHD?
Basically, there's two types of treatment. You're going to have your biomedical treatment, where you're looking at the digestive system and you're looking for viruses, yeast infections, parasites, immune responses, things of that nature. And then you have the neurological approach, which is what we do with regard to building up the brain's capacity in the areas that are under functioning, and areas in this case that would regulate attention, focus, and things of that nature.
Do your therapies, do they complement this, or do they replace the medications?
Our goal is always to either stop the child from taking medications or to get him off the medications, and we've done that successfully several times, where we have a child slowly, in coordination with his pediatrician or pediatric neurologist, and we have them reduce the dosage till they're off the medication. So they can work in conjunction.
Are kids that coming into your office, are they over-medicated?
Some kids, yes, are over-medicated. Some kids absolutely need to be on medication, but many of them can be, like I said, weaned off or have their medication reduced so they can function, because you know, a lot of these medications, the most popular ones are stimulant medications, and they're going to give you side effects, stunted growth, loss of appetite.
What makes you qualified, tell us tonight, to treat ADHD?
One is I have specialty training in chiropractic neurology or functional neurology, which is a brain-based approach. The other is I have additional training in childhood neurobehavioral disorders. And what sets us apart really is, I think, the results we get. If you talk to our parents, our kids are getting better, our kids are getting off medication. And recently there was a study in the International Journal of Adolescent Medicine that showed that this approach in a 12-week period increased the child's reading scores and math scores 2 grade levels in 12 weeks.
Parents out there, their children are on ADHD medicine, they're concerned about that. What do they do to find an alternative? What do you recommend parents do? You
know, read up as much as you can about it. An educated parent is the most informed, and you can do the best. You are your child's advocate. You can structure. The kids need structure, and they don't like changes. The more you structure things, the better they do. And then seek out approaches, like I said, the one with the biomedical approaches or neurological approaches, or what we do, we combine the two. That seems to be what we think is getting the best result.
All right, Dr. Mañé, thank you so much for joining us tonight.